Welcome to the Coral Study. I'm Dr. Barbara Warnes, a trial manager at the Bristol Trial Centre at the University of Bristol. In this presentation, I'm going to give you an overview of the Coral Study. It will cover the background and design of the study, the research question you want to answer, and GP practice involvement. This video is for the principal investigators at the GP sites, clinicians and site staff who will be helping with the eligibility searches, as well as anyone who will be interacting face-to-face with participants, such as research nurses, clinical pharmacists, or research practitioners. Thank you for listening. Before we start, I'm going to remind you of the importance of good clinical practice, or GCP. GCP is an important ethical and scientific quality standard for the design, conduct, performance, monitoring, auditing, recording, analysis, and reporting of clinical trials. GCP states that the right, safety, and well-being of the trial subjects are the most important considerations and should prevail over interests of science and society, and that all clinical trial information should be recorded, handled, and stored in a way that allows its accurate reporting, interpretation, and verification. Listening to this presentation, so you're trained to perform your role in the Coral Study, is one of the ways of ensuring that you are compliant with GCP. Anytime you see this green key, it means we are noting a key aspect of GCP that is relevant for the Coral Study. The Coral Study is being conducted to support the licensing of a medicinal product and, as such, must be conducted in accordance with the Medicines for Human Use Clinical Trials Regulation and is subject to oversight and inspection by the MHRA. Heart failure is a long-term condition that affects almost 1 million people in the UK. Symptoms can significantly impair quality of life for heart failure patients and include breathlessness, fatigue, and leg swelling. The investigational drug we are testing in the Coral Study is called coenzyme Q10, or CoQ10. CoQ10 is a nutrient naturally found in nuts, meat, and fish. It can be bought as a health supplement in health food shops or pharmacies. Previous research suggests a potential benefit of CoQ10 in heart failure patients on all-cause mortality and hospital admissions. However, more research is needed when looking at whether it can improve quality of life and the symptoms of heart failure. The IMP and placebo for Coral are being produced by Pharma Nord. We've been funded by the NIHR HTA to answer the research question. In patients with heart failure with reduced ejection fraction, is the addition of CoQ10 to usual care clinically and cost-effective? We have two main objectives. Firstly, to determine whether CoQ10 improves symptoms and quality of life in people with heart failure, and secondly, to determine whether CoQ10 is cost-effective. Coral is a pragmatic randomized controlled trial, or RCT, with a cost-effective analysis. The first 6 months of recruitment forms our internal pilot, where we aim to recruit 310 participants from around 30 GP practices. Overall, we plan to recruit 950 participants across England in the 5 RDNs listed, from around 75 GP practices between February 2025 and April 2026. The primary outcome of Coral is participant-reported heart failure-specific health-related quality of life assessed using the Kansas City Cardiomyopathy Questionnaire, or KCCQ, 12 months after randomization. These data will also be collected at 4 other time points, baseline, 3, 6, and 9 months after randomization. We have a number of secondary outcomes, including all-cause death, all-cause hospitalization, major adverse cardiovascular events, and resource and health service use. The secondary outcomes will be collected via participant-completed questionnaires, medical records, and NHS England. In the Coral Study, participants will be asked to take 1 capsule 3 times a day with food for 12 months. The capsules will either contain 100 milligrams of CoQ10 or will be a matched placebo. They'll be sent directly from pharmacy to you to the participant's home. Participants will then complete 5 questionnaires, first at baseline, then 3, 6, 9, and 12 months after randomization. The questionnaires will ask about their symptoms, quality of life, whether they have used the NHS or had any help or care. Each questionnaire will take 20 to 30 minutes to complete, and participants will be offered a £10 gift voucher per completed questionnaire. The Coral BTC team will coordinate the questionnaire completion. We hope that most participants will complete the questionnaires on paper or online, but we have included provision for face-to-face appointments by the CRN Agile or Direct Delivery team or GP staff if this can be accommodated at your site. The first 190 participants recruited into the study will be asked to take part in a medication counting exercise. We will ask these participants to send back any capsules that they haven't taken to the Bristol Trial Centre so we can objectively measure adherence. This will be organised by the Coral BTC team. The inclusion criteria for the study are as follows. Participants must be over 18 years old, with evidence in their GP record of heart failure and left ventricular systolic dysfunction, or LVSD. Evidence of LVSD will be in QOF codes or in letters or notes in GP records. Participants must also indicate that their heart failure has an impact on their daily life by scoring class 2, 3 or 4 on the New York Health Association score, or NYHA. The NYHA is a scale for assessing symptoms of heart failure. Their score will be confirmed by the participant during the screening process with the Coral BTC team. The exclusion criteria for Coral are as follows. Systolic dysfunction with ejection fraction of over 50% or preserved left ventricular function. Supplementary CoQ10 intake within the last 6 weeks. We will check this at screening, but to highlight here that some health supplements or multivitamins contain CoQ10, but it is not listed on the main label. Also of note is that CoQ10 goes by a few names and might be listed as ubiquinone or ubiquinol. Current warfarin use, as CoQ10 may reduce the anticoagulant effects of warfarin, a known allergy to soy or peanuts, or currently enrolled in another interventional clinical trial. Participants must be able to give informed consent to take part in Coral. Importantly, we are trying to be as inclusive as possible. We will ask you to confirm whether the participant has capacity or not, but we ask that you do not exclude potential participants because of things such as language barriers, as we are translating documents and have provisions to use a translator service, or exclude them for mild cognitive impairment. As our primary outcome measure, the KCCQ has been validated in patients with mild cognitive impairment. Participants will also not be able to take part due to diet choices, as the capsules contain halal bovine gelatin. For women only, if they are pregnant or breastfeeding, they will not be able to take part. Women who are under 55 who are premenopausal will be asked to complete a pregnancy test before giving consent. Please note that some of the exclusion criteria will be assessed by the GP and checked by the participant at screening, and some will only be asked at screening. This is indicated with the blue and green circles. This slide shows the first part of the GP practice tasks for recruitment. First, an initial database search will be conducted to produce a report of the anonymous demographic data for the patients with coding for heart failure. Then a search will be run to identify the patients with heart failure who do not have LVSD coded. Staff will then manually look through the list and add the LVSD QOF codes to the relevant records where there is evidence of it in the medical notes, for example from echo results or outpatient letters. A further database search is then conducted, which will produce a report of the anonymised demographic data for the patients with coding for heart failure and include those with newly coded LVSD. Finally, a search will run to identify potentially eligible participants for the Coral study. This search will identify people over 18 with heart failure and coded LVSD and excludes people taking warfarin, those with a soy or peanut allergy, or those with a coded lack of capacity. The people identified in this search will proceed to eligibility screening, where all the eligibility criteria need to be manually checked. This step must be completed by a GP. There is more information on this in the database searches training video and EMIS and Systems 1's instructions. Next, a member of staff at the practice will upload the final list of eligible participants to DocMail, who will send out the invitation packs in the post. These will contain an invitation letter on headed paper with a GP logo, a brief study summary, a paper expression of interest form which can also be completed online, and a pre-paid envelope. At least 2 weeks after the invitation packs have been sent out, site staff will send a reminder text via DocMail to the non-responders, if the person has agreed to receive text messages from their GP practice. After at least another 2 weeks, further non-responders will be contacted by phone by staff from the GP practice to see if they're interested in taking part. The Coral BTC team will provide you with a list of non-responders at both time points. After we receive an expression of interest at the Bristol Trial Centre, the Coral team will call the participant to verbally check the relevant eligibility criteria with them. If a participant is eligible and happy to take part, they then give their informed consent. This can be done on paper or online and will mostly be by remote consent. However, if your site has capacity and you would like to offer this, participants can come into the practice to complete the consent process. This will only be offered if you agree to it. CRN Agile teams may also be able to assist with this. After giving informed consent, the participant completes the baseline questionnaire. We then ask a GP to confirm that the participant is still eligible according to their medical records. This step is to make sure nothing has changed, such as the participant hasn't started taking warfarin or become newly pregnant since the first eligibility check. To complete this step, you'll be sent an email with a link to click on that will take you to a form to complete. We cannot send participant identifiers in this email and will only supply you with the Coral Study ID. You will need to confirm the identity of your patient from the spreadsheet that you completed at the first eligibility check. A clinical member of the Coral Trial Management Group will then sign the e-prescription for the participant. The participant will then be randomised to have either active CoQ10 or placebo, and the first batch of study capsules will be sent to the participant's home free of charge from pharmacy to you. Neither the Coral BTC team or the participant will know which capsules they have been allocated. This will only be known by the staff at pharmacy to you for dispensing the capsules, and the pharmacy at University Hospital, Bristol and Weston for emergency unblinding. There are some important things to note for the Coral study. Firstly, participants cannot take part if they are taking warfarin, as CoQ10 may reduce the anticoagulant effect. If participants are prescribed warfarin, please inform them to stop taking the study medication and to contact the Coral study team. If participants are taking antihypertensives, please ensure that the standard monitoring of blood pressure takes place and report changes of concern to the Coral study team. This is something we need to monitor in order to fulfill the safety requirements of the study. Participants who become pregnant will be asked to stop taking the study medication immediately and to contact the Coral study team. They will continue to be followed up until the end of the study. There are some other site tasks that you will need to complete. A key task for your site is to maintain and store your study delegation logs. It's an important principle of GCP that any staff conducting study activities are appropriately trained and qualified to do so. Delegation logs are a way of demonstrating this training, which is why they are so important. Any changes to the delegation log, including new members of staff or staff leaving, need to be signed and dated by the PI and emailed through to the Coral BTC team. You can add additional staff to the study after your site has opened. However, you'll need to await confirmation from the study team before new staff members can undertake tasks. After a participant from your practice has joined the study, we will notify you with a recruitment letter and a copy of their consent form. We ask that you file this letter and the consent form in their medical record and complete the actions on the letter, which include adding an alert to the patient's general record regarding warfarin and that CoQ10 is an externally issued medication. We will also send you a number of email alerts at different points during the study. These will include when a person has been deemed ineligible or eligible after a screening call with a member of the Coral BTC team, whenever a prescription has been authorised or dispatched for one of your patients, if there is a change in participation status, for example, if the patient decides to stop taking the medication or withdraws their consent, and if we find out about a safety event. For each of these emails, you must save a copy in the relevant person's medical record. We may need more information from you about a safety event, but we will let you know if this is the case. Database searches will be provided to collect data on participant medical records at baseline and 12 months post-randomization. Data collected will include long-term health conditions, prescribed medications, inpatient and outpatient care, GP consultations and referrals. The Coral BTC team will contact you to let you know when and how to perform the searches. We are also asking you to report any safety events to us when the PI becomes aware of them. I will go over this in more detail in the next few slides. You will obviously become aware of safety events when your patient presents at the surgery. However, we are also asking PIs to complete regular reviews of the patients who are taking part in Coral to check for any unreported safety events. We have suggested a monthly review. We expect each surgery to recruit around 15 participants and follow-up is for 12 months. These reviews may be supported by an administrator at your practice, as long as the PI is the one to assess the events. In the instance that you become aware of any untoward medical occurrence that represents a change in a clinical condition, the PI must first record the assessment of the event in the medical notes. The PI should determine whether it is serious and related to the Coral IMP. Second, they must decide how to report the event using the GP safety reporting requirements flowchart, which I will go through now. This is a copy of the GP safety reporting flowchart, which is also available in the study handbook. The flowchart and countdown start when the PI is made aware of an adverse event. The first step is for the PI to decide whether the event is serious, i.e. it meets any of the criteria here on the right. Serious events result in death, are life-threatening, require hospitalization or prolong an existing hospitalization, result in disability or incapacity, or consist of a congenital anomaly or birth defect. The next decision is whether the event is causally linked, in other words, related to the IMP. There are 5 categories for relatedness. If the PI or delegated clinician deems the event to be possibly, probably, or definitely related to IMP, this means that the event is an adverse reaction. Reporting requirements depend on the category of the event. If the event is both serious and possibly, probably, or definitely related to the IMP, this is a serious adverse reaction. These events must be reported to UHBW via email and the Coral study team using the UHBW Safety Initial Report form within 24 hours of the PI becoming aware of the event. Serious adverse events or adverse reactions should be reported to the Coral study team via email using the GP safety reporting form as soon as possible after you become aware of the event. Adverse events do not need reporting to us. Importantly, for all events, you should document in the medical records your record of assessment and the action that was undertaken. Forms can be found on the Coral website, and the link and the password are shown on screen. As mentioned earlier, you can opt in to offering participants face-to-face appointments for the study, to receive informed consent, or to help participants complete study questionnaires, if you have both staff and room availability. We don't anticipate many participants will request to do this. However, there are additional site payments for each face-to-face appointment available. Receiving informed consent must be carried out according to GCP guidelines. Consent must be voluntary and informed, and participants must have the capacity to consent for themselves. Informed consent is obtained by revisiting the study information provided to ensure that the subject understands the study, its risks, and what participation in the study would involve. This may be assessed by asking the participant to explain what they understand about the study, e.g. the frequency of questionnaires, the intervention, and possible side effects of the pills, and by answering any additional questions that they have. Importantly, site staff must be delegated to complete these tasks on their delegation log before undertaking them. Blank consent forms and questionnaires can be downloaded from the website at www.coral-study.bristol.ac.uk in the GP info section. We anticipate some participants may need an impartial witness or a translator to help understand participant documents and for consenting. This could apply to sites, as we might ask site staff who are not on the delegation log to be an impartial witness. Alternatively, you may need to use a translation service when talking to participants. More details can be found in the study handbook. If there is an emergency or clear clinical need, participants can be unblinded to their study allocation 24 hours a day, 7 days a week via the UHBW pharmacy. The contact details are on the slide. If you hear of a participant wanting to withdraw from the study, please contact the Coral BTC team. Participants can stop taking Coral Study medication without withdrawing, so carry on completing the questionnaires, withdraw access to their medical records, or withdraw from the study completely. Finally, if you become aware that a Coral participant has died, please let the Coral Study team know as soon as you become aware, using the contact details on the slide. GP site setup involves the following steps before you're given the green light to begin participant recruitment. For training, most study-specific training is done by watching online modules. The first module is this overview, which must be watched by the GP research lead, any clinician who will be running eligibility checks, and anyone who will be interacting with participants face-to-face. The second module is the database searches and screening video, which covers the specifics of checking patient eligibility and LVSD coding. This needs to be watched by all clinicians who will be adding the LVSD coding or completing the eligibility checks. Other site staff who are supporting the study only need to read the Coral Study Handbook. For documentation, the GP research lead must send us a copy of their GCP certificate and a 2-page signed and dated short CV. All staff involved in the study must complete a training and delegation log, so there is one per person, which is maintained by the GP research lead. For agreements, please complete the GP registration form, which we will then use to populate the Model Non-Commercial Agreement, or the MNCA, for you to sign. Please note that the MNCA is the official contract and confirms that you have capability and capacity to take part in this study. Once all the above is in place, your surgery will be given the green light to open. Full details can be found in the site opening and green light process handbook. We will not be providing sites with traditional paper site files. Instead, to be more environmentally friendly and ensure all sites have access to up-to-date documents, a central site file will be held on the study website. This can be found at www.coral-study.bristol.ac.uk and selecting the GP Sites Only tab. The section is password protected and you can enter using the word coenzyme in lowercase. All site file documents will be accessible here, including the protocol, patient information leaflets, as well as the approval documents. Additionally, in the training section, you'll be able to access the appropriate training modules. As a site, you are responsible for keeping the training and delegation logs and signed MNCA stored safely. This is one of the ways you're compliant with GCP. At the end of your involvement in the Coral study, we will need to close your site. Close down will include archiving of any paperwork, adding end dates to the delegation logs, and sending any leftover capsules back to the Coral BTC team if you have received any. We will be in contact with you when it is time to close down your site and to give you more instructions. The following payments are available for the Coral study. The one-off costs include £779 for site setup and £204 for the close-down fee. The per participant cost will be paid to you according to how many participants have been randomised from your practice. These include payments for baseline and 12-month medical notes review and eligibility reconfirmation. If you see participants face-to-face for informed consent or for questionnaire completion, there are additional payments for this. For the full details of the service support costs, please see the relevant RISP or your RDN's website. So what next? If you'll be helping with database searches, adding LVSD codes or eligibility screening, you will also have to watch the video on the database searches and screening. For other GP site staff, i.e. if you're not a GP and you're involved in the CURL study, you must read the study handbook. Any administrators or other site staff who won't be interacting directly with the CURL participants must watch the safety reporting video. All training documents can be found on our website in the For GP Sites section. The password for this section of the website is coenzyme. Now is the time to collate the paperwork for the study, including the PI's GCP certificate and CV, completing the training and delegation logs for any staff members working on the study, and the MNCA, which is the site contract. Blank copies of the training and delegation logs can be found on our website. The code word for the training module is staghorn. You will need to enter this on your training log. Thank you very much for supporting our study and for watching this training module. If you have any questions, please contact us using the study mailbox. You can also call us on 0117 455 6725. Finally, just a reminder that if you would like a remote meeting to go through anything for the CURL study, please let us know and we can arrange this with you.